Hi, I'm Paul Silovsky, physical therapist and owner of Rebound Physical Therapy. And today I wanted to talk to you about a very simple definition or an explanation of what physical therapy is without getting into a textbook or a complex, real collegial definition. So I'm going to call this move or be moved. So what is physical therapy with regards to movement? It's really, really simple. I think good physical therapy provides movement as a medicine for healing. And really there's three things that can happen fundamentally with regard to motion or movement. One, you can move yourself, which in my world would be corrective exercise. More on that in a second. The second one would be when the therapist moves you, which is manual therapy, right? Either the soft tissues or the joints or your extremities, your limbs, maybe stretching your hamstrings or digging into the hamstring or the hip manually, or even the joints of your spine, right? That's manual therapy. And then there would be the combination of the two where you would do some movement yourself and the therapist would help you move, which is totally fine too. So it's manual therapy and the corrective exercise. Now, when it comes to moving, you really should be doing it from the viewpoint of creating a therapeutic effect on the body. In other words, you want to promote soft tissue healing or speed up the healing process. Maybe you want to correct some asymmetries. Let's say I had, my right shoulder was lower than my left and my back was hurting on the right side because like an accordion, I was compressing things. I could, through exercise or motion and manual therapy, relieve some of the stress on that side to make myself more symmetrical, more upright, more even, if you will. And then obviously through motion and exercise, you can optimize strength and mobility and function, which are all components of what I'll call good physical therapy. So when it comes to exercise or corrective exercise, we're trying to correct the painful condition, get the body in symmetry, promote and speed the healing process, and really just get someone back to function. The same is true of manual therapy, right? So when you're doing manual therapy, you're going in there to get the tissues moving correctly. If a patient is having a hard time moving themselves, sometimes it feels better to have the therapist help you move. Or if you're stuck in a particular position or the joint is super restricted, manual therapy can help really free that up and again, speed that process. So the mantra is here, move or be moved. And oftentimes it might be both. So there's nothing wrong with that. I think good physical therapy would involve all three. But ultimately, we want to teach the patient how to move themselves and do corrective exercise so they can move into doing exercise on their own. Because the whole purpose behind good physical therapy and corrective exercise is to allow you to function the way you want to function without having to always do or take corrective measures, and be able to exercise on your own and know how to heal yourself and or keep yourself healthy. So, the corrective exercise concept is to move you out of pain and dysfunction or out of what we call dis-ease, right? You hear the word disease, which, would connotate that something's not easy, something's not optimal. There's a function of your body or a system in your body. It could be the muscular system, the skeletal system, the nervous system, the cardiovascular system. Any of your systems or any of your organs, any aspect of your body could be non-optimally functioning or not performing easily, thus dis-ease. And we move you out of a condition of dis-ease into a condition of ease because motion should be normal. It should be easy. Function should come about because of your desire to get things done. We just help you move through those barriers more quickly with either getting you to move yourself in a corrective way, us moving you in a corrective way, and then teaching you, what's causing your dis-ease and enabling you to continue healing yourself and do corrective exercise. So anyway, there's a one simplistic view of how you can view physical therapy, move or be moved, so that you can get back in action and enjoy the things you like to do in life at a high functional level, which is really our goal. And if you need help with this, please reach out to Rebound at 785-271-5533. We're happy to help.